Okay, we are back. This is Senate Health and Welfare, and it is January 19th. We're joined by Ledge Counsel Katie McClinn, and we're going to introduce ourselves to two bills. And I think the best thing to do is, since I'm the lead sponsor on both of them, I will first introduce S90. And I want to say that S90 is a bill that is near and dear to, I think, all of us. We're all signed on to the bill. We're all equally co-sponsors. And there are folks in the Senate Education Committee who are also sponsors on the bill and see a compelling need for going forward with it. My interest in the amyotrophic lateral sclerosis registry, the ALS registry, really began several years ago as a member of the Lake Champlain Citizens Advisory Committee, when we learned that there is possible link between certain chemicals that are found as a result of cyanobacterial contamination, that there now are some published articles, peer-reviewed articles indicating a link between ALS and possibly cyanobacteria byproducts. So I want to caution ourselves as we have that conversation that we're not drawing any conclusions about any algal blooms or algae or anything else, but we're interested in knowing is there a group of folks in our state that have had ALS, and is it a significant issue for us? Is it a cluster, for example, from the public health perspective? So that's my interest, and I'm very concerned because, as many of you know, people who have succumbed to ALS as a devastating disease. I also know people who have, and some acquaintances and some friends. So, and I know each of you may have stories to tell. I don't have anything more to say at this point, except I know that this is a concern. I did have a letter. I can't share who it's from. I can't share its content, but I can say that I have had a letter of support from a member of legislative staff around this illness, someone who is very concerned about it and very much supports our going forward with this bill. And so I want us to understand that it does hit very close to home for many of us. So, Katie, thank you for being here. And let's go through S90 and see what we have.
Okay, good morning. Katie McClinn, Office of Legislative Counsel. I will pull up the document. Oh, the host has disabled participant sharing. Aaron, do you mind giving me sharing capacity?
I just did.
Thank you. Okay, take two, more successful. So here's S90, and just to give you a brief overview before we look at the language, this language creates an ALS registry that would be housed within the Department of Health. And this piece of legislation governs how information is transferred to the Department of Health from providers and facilities, who has access to the information in the registry, how information can be shared from the registry. So first, we're creating a new chapter in Title 18, the health chapter about ALS. Our first section is a definition section. So for the time being, I will move past that and move right into section 172, which is the establishment of the ALS registry. So in subsection A, it directs the Commissioner of Health to establish a uniform statewide population-based ALS registry system for the collection of information determining the incidence of ALS and related data. And then we have cross-reference to our rulemaking statute chapter. So we're directing the commissioner to adopt rules under the Vermont APA that are necessary to affect the purposes of the chapter, including the data that is to be reported and the effective date after which reporting by a healthcare facility and healthcare providers shall be required. So that's all being adopted in rule by the commissioner. Then in subsection B, all cases of ALS diagnosed or treated in the state are to be reported to a representative of the health department who's been designated by the commissioner to compile the ALS data, or any individual, agency, or organization designated to cooperate with that representative of the department. And then in subsection C, the commissioner is directed to establish a training program for personnel for participating healthcare facilities and a quality control program for the data that's being collected. The commissioner is to collaborate in studies with clinicians and epidemiologists and publish reports on the results of these studies. And the commissioner is to cooperate with the National Institutes of Health and the US CDC in providing ALS incidence data. And then in section 173, we have the participation in this particular program. The first paragraph A governs healthcare facilities, and then the second paragraph B governs healthcare providers. So the facility that's diagnosing or providing treatment to patients with ALS are to report each case to the commissioner or the commissioner's representative in a format prescribed by the commissioner within 180 days of admission or diagnosis. And if the facility fails to report in the format that the commissioner has directed, the commissioner is authorized, or the commissioner's authorized representative is allowed to enter the facility to obtain the information and report that information in the appropriate format. And in any case where this happens, the facility is to reimburse the commissioner or authorized representative for the cost of obtaining and reporting information. Next, with regard to providers, any provider diagnosing or providing treatment to patients with ALS shall report each case to the commissioner or his or her authorized representative within 180 days of diagnosis. And in subsection C, we have that all facilities and providers who provide diagnostic or treatment services to patients with ALS are to report to the commissioner any further demographic, diagnostic, or treatment information that's been requested by the commissioner concerning any person who is now or formerly was receiving services. And in addition, the commissioner or the commissioner's representative shall have physical access to all records that would identify cases of ALS or would establish characteristics of ALS, treatment of ALS, or medical status of any identified patient with ALS. And then a willful failure to grant access to these records would warrant a fine of $500 for each day that access is refused. All fines collected under this subsection would be deposited into the general fund. Section 174 governs confidentiality. So all of the information that is reported under this chapter is exempt from public inspection and copying under the PRA. So it's all kept confidential. And subdivision 2, all identifying information regarding an individual patient, provider, or healthcare facility contained in records of interviews, written reports, or statements procured by the commissioner or any other person, agency, or organization acting jointly in connection with ALS morbidity and mortality studies is exempt from public inspection and copying under the Public Records Act. So that information is also kept confidential. It's used solely for the purposes of studying ALS. And then we have language that nothing in this section is to prevent the commissioner from publishing a statistical compilation that doesn't identify individuals or particular sources of information. And then in subsection B, as you know, the Public Record Act's exemptions are revisited periodically to see if any of them should be repealed. So this is saying that this Public Records Act would occur notwithstanding that and not be repealed through that process. Section 175 addresses the disclosure of information. The commissioner is allowed to enter into agreements to exchange confidential information with other registries in order to obtain complete reports about Vermont residents who are diagnosed or treated in other states, and to provide information to other states regarding their residents that might be treated or diagnosed in Vermont. So this is reciprocity language. In subsection B, the commissioner may furnish confidential information to other states' ALS registries or health researchers in order to collaborate with a national ALS registry or to collaborate in ALS control and prevention research studies. However, before releasing any of that type of information, the commissioner is to first obtain from those state registries, agencies, or researchers an agreement in writing to keep the information confidential, identifying information confidential and privileged. And in the case of researchers, the commissioner is also to first obtain approval of their academic committee for the protection of human subjects. And then lastly, we have a liability section. So in subsection A, it directs that there will be no action for damages arising from the disclosure of confidential or privileged information that might be maintained against any person, employer, employee who participates in the good faith reporting of the ALS registry as is prescribed in this proposed chapter. And similarly, no license of a facility or provider could be denied, suspended, or revoked for the good faith participation of disclosing confidential or privileged information pursuant to this particular chapter being proposed. And then sort of the exception to that is in subsection C, that nothing in this section would be construed to apply to the unauthorized disclosure of confidential or privileged information if the disclosure was due to gross negligence or willful misconduct. So if the information was disclosed in a manner that's not only not prescribed by this chapter, but rises to the level of gross negligence or willful misconduct, then action could be taken under that particular premise. And this bill was introduced last year, so it has a July 1, 2021 effective date, which of course would have to be updated if this committee chose to move forward with this bill. And that is
Good.
it.
Yeah, why don't we take it down? I think we have it on our iPads. And I do have a question actually that we're probably going to have to ask Department of Health and others. Currently, language relating to registries and violations for not adding to registries. Katie, is this typical language, or would it go through a board of medical practice? Is there another way of doing it? I don't know.
Yeah, I would have to take a closer look to see what's in statute. When I was reading through it again before coming in, I was, maybe a little bit surprised to see it, and perhaps it is something that could be handled by a professional board.
Yeah.
But until I really maybe look at some other registries, I don't have a kind of a definite answer for you.
Okay, yeah, good. And we don't, there are, I think ALS is currently a reportable disease. So it's being reported, but I don't know whether all of the information that's going along with it is included. So we just went through this in the LCAR with rules looking at reportable diseases. And I happen to remember that ALS was on that list among many others. Questions for Katie, committee, because what we need to do is we need to consider who we need to hear from in the process. Obviously, we have some personal stories we're going to hear, but in terms of the bill itself and how it is structured, who would you like to hear from? We got Department of Health, obviously. I'm thinking of Sarah Voss, who is the state, one of the state, I wish she's still there, epidemiologist. Maybe Patsy Kelso is the person. We'll have to look at that. Go ahead, Senator Hardy.
Oh, I think Senator Terenzini had his hand up first.
Oh, all right.
Oh, thanks, Senator Hardy. we invited Senator Dr. Stommel from Dartmouth.
Yes, yeah, we
Okay.
have both the docs, one from UVM and one from Dartmouth. The issue is their schedule, so we may not be able to have them in until mid-February, which means we would put this together for some testimony mid-February and then try to move it forward. I think we might want to hear from Department of Health a little bit of the background information on registries. So we'll have to talk about that during our agenda meetings.
Is there any indication that our companions on the House side, they would be motivated to move this forward this back half of the biennium?
I think they might. We're going to have that conversation again. But I think if we can build up support on our side, it will go forward. It's not one of the questions that, of course, we have is what's the cost for putting together and maintaining a registry? So that's an issue we're going to have to dig into. Senator Hardy, go ahead.
Thanks. This is actually a question for Katie, and it's kind of along the same lines as the other question about the fine. Just in the section 173 participation in the program, the language that says if a facility fails to report that the commissioner may enter the facility, obtain the information, that seems a little like heavy-handed. So I'm wondering if there's a better way of saying. I just imagine Mark Levine like trucking into a hospital with his like briefcase in hand or whatever. So it's
pretty specific.
Yeah, thinking about maybe a lighter touch way to say that. But maybe if we could get some information about what registries already exist and how those work, that would be helpful.
Sure.
Yeah, good. Yeah, that we need to do that. I'm thinking DOH will be the stop to get that info. We'll do that. Other questions for Katie while we have her? Yeah, I think the penalty area and the fine area and the access to the facility area, that whole section, it just seems like overkill. Oh, maybe that's the way it's done. I don't know, but so we'll have to figure that out. And then how registries are done will be DOH. We'll have them come in. Maybe we can do some legwork on this before and have another meeting on the bill before we get some of our other expert witnesses in. Senator Hooker.
Thank you. What's the intersection between a registry and a reportable disease? And
that's exactly what we want to find out. You're right. Yeah, that was the question. If you're reporting it, I mean, it's already being reported, then what more do we have to do to put it into some form to analyze if there's a cluster in a specific area of the state or the state as a whole based on population?
Yeah. And you mentioned boards that may be able to implement this. So would legislation be necessary?
No. My mention of the board was the enforcement piece. Would this just be a matter of professional board of medical practice? Katie, you probably can help us with that.
Sorry, I was looking for other registries in Title 18.
Okay.
Yes, I think that is another avenue worth discussing, that a professional board might be a more appropriate place to put some type of violation. I was also struck when I was reviewing the bill again for the first time after a year that some of, to see some of those penalties.
Yeah. Okay. It's great to have something sit for a little while and come back to it. And you say, "Ooh," it's like writing a paper, right? You let it sit for a while and it gets better the next time. Okay. What else? Anything else? So committee, what I'm hearing you say is we want to know what is a registry? What's the difference between a registry and a reportable disease? What are the costs associated with a registry? What are the requirements for a registry as compared with what we have in the bill? So we'll have to hear about that. Then we're going to want to hear some information about ALS itself, and those would be the two docs that we've reached out to. There may be others. And then we want to hear personal stories about this as people have been affected. So I think that puts together some comprehensive legislation or testimony rather. And the Department of Health is going to have to weigh in on this to help us understand a lot of it. Anything else? Okay. Katie, anything you can do to help us would be appreciated. As usual.
Happy to help.
All right. Okay. So that is S90. The other bill, and I have to say, the reason that S90 and S19 are up here, the same reason that S91 is up on our agenda going forward. And that is, these are little leftovers, holdovers. They were, S19 was actually introduced before the pandemic started. And we did act on it in our committee before this committee was constituted. It was a different committee. And we did send it, I think we sent it as far as the House. Do you remember? I don't remember. Anyway, so S19, my interest in S19 is this. As I started researching, believe it or not, Hurricane Irene, and looking at what is in our hazard mitigation plan for the state. If you go through that plan, go back to 2019, because it's probably changed by now, you realize that there's nothing in it, or that healthcare is at the very bottom of the list, and there's very little about healthcare in it. And as I started thinking about Irene as the point of the spear or the tip of the iceberg or what's coming with climate change and our weather changes, we're going to see more storms. We're going to see weather changes. We're going to see temperature changes resulting in new diseases and new healthcare requirements. So I put together this little bill. It's not a huge bill, but it does suggest that at the local level, and a regional level, we begin to think about healthcare within hazard mitigation. And so if you look through the bill, then you'll see there are certain diseases that are going to predominate or increase going forward with climate changes. And at least one of those, which is a very, a real concern for me in particular, is the tick-borne illnesses that is wreaking havoc in the Northeast part of the country. And so we'll look at that. Asthma is another one. We're not as affected in our state, but other states are. And so in working on this, the Department of Health has worked with the CDC on plans for mitigating climate change and healthcare issues in climate change. So we'll go through the bill, and then we can talk about how to go from there. And Senator Terenzini, I'm stopping short because I know you have a question.
Sorry to cut you off there.
No, it's okay. I'm going on.
No, I just think I read the bill, and I think a lot of it goes hand in hand with what we were just referring to with S90, and is the blue-green algae or those other organisms we're finding in lake water because of temperature rise. Is that leading to these neurological diseases? So I think they, in a lot of ways, pair nicely from what I can see so far.
Yeah, I agree. Good comment. Yeah, agree. So, all of which is to say that in my contact with the medical community about how tick-borne illnesses in particular are handled, there's a division between those who do initial testing and get a negative test, let's say for Lyme disease, and then people are stuck with whatever illness they have if it comes back negative, and more confirmatory tests for Lyme and babesiosis, relapsing fever, and others don't go forward unless you find someone who's willing to do that. So as Lyme becomes more and more predominant, we're going to need to ask our medical community and overall to be more engaged in supporting people who report the what do you call them? Well, report that they have Lyme disease. Okay. So Katie, let's look at the bill. Nobody wants to
Okay.
hear me talk.
I'll pull it up. Okay. So this bill is really broken into two parts. The first part looks to the Department of Health for the creation of a plan to help mitigate and develop a response to climate change. And the second part has to do with engaging the regional planning commissions to identify and also address public health risks related to climate change. So first, in Title 18, there's the creation of a new chapter, Public Health Response to Climate Change. And the first section has to do with a climate change response plan. So this directs the Department of Health in collaboration with the Chief Prevention Officer to develop and adopt a statewide climate change response plan to foster resilience to the impacts of climate change in Vermont. Subdivision 1 specifies that using a public health model, the department's response plan is to seek to prevent and mitigate public health risks caused by climate change in Vermont. In particular, attention being shown to vulnerable populations. And then we go on to list what those populations are. So it's infants and young children, elders, persons with physical disabilities, persons with a chronic or existing medical condition, persons with low income, persons who are homeless or lack access to transportation, persons living in floodplains, and persons whose employment occurs primarily outdoors. And then in subdivision 2, the plan is to provide actionable strategies specific to both rural and urban communities, including specific strategies that address mental health, vector-borne diseases, waterborne and foodborne diseases, hot weather, cyanobacteria, extreme storm events, and air pollution pollen. The next section has to do with how information is shared and how communication happens across sort of various sectors. So the Department of Health, in coordination with regional planning commissions, regional emergency management providers, and the Citizens Assistance Registry for Emergencies, is to develop a plan and communicate with both Vermont communities and each other for the purpose of mitigating and responding to climate change related to public health risks in Vermont. And then there's a reporting requirement. Again, this was a bill introduced in 2021, so this July 1, 2022 date would have to be pushed back if you chose to move forward with this bill. But by July of 2023, the department would submit the response plan to this committee to Healthcare and Human Services. And then, sort of changing gears a little bit, the next few sections have to do with how the regional planning commissions can be involved in healthcare works and identifying healthcare needs. So this first section lists the duties of regional planning commissions. And there are two items that are added to this list. First, they're directed to consult with and assist hospitals regarding the development of health needs assessment and other initiatives as needed. in accordance with the requirement that we'll see in section 4, the public participation and strategic planning requirement for hospitals. And secondly, regional planning commissions are directed to consult with and assist with AHS, the Department of Health, and the Vermont Emergency Management to incorporate public health and safety concerns related to climate change into the state and local emergency hazard mitigation response and recovery plans. And then we have this section 4. This is the existing language about requiring each hospital to have a protocol for public participation and its strategic plan for identifying and addressing healthcare needs. And then the new language here just kind of cross-references what we've already said in section 3, which is that regional planning commissions shall be available for consultation on this. I believe that's it. Yes. So then we have our effective date, which would need to be updated.
Okay, questions for Katie? So I will say that this iteration of the bill is the result of testimony that was taken by Department of Health, the Vermont Alliance of Hospital, the Hospital Association, the RPCs, the Wyndham RPCs, the chair of that, executive director of the Wyndham, it was the chair of the statewide regional planning commissions at the time, and also the Chittenden County Regional Planning Commission and their work. We did hear from the E911 folks on their how they deal with people who are isolated during an emergency and an emergency management. So all of those people have weighed in to build this specific draft. And one of the things that you will hear probably, should we decide to go forward with this, is, oh, we're already doing that. So we'll see what we hear. Go ahead, Senator Hardy.
Thank you, Madam Chair. So this bill is a couple of years old, and there's been a ton of work in the last couple of years since this bill was originally drafted. I had some concerns with this bill, the original, and tried to get some amendments, and the committee was not in favor of those amendments at the time regarding health equity language. I'm just looking, I was scrolling through the Climate Council's report to see the recommendations there. And there are a lot of embedded recommendations that are relevant to this. And so I really am a little reluctant to take this bill on right now, given that the work that's been done by the Climate Council. I would want to be sure that this is better aligned with all that work. And so we're not sort of at cross-cutting against what is happening.
I don't think we'll be cross-cutting. In fact, I think we probably have stimulated the interest in this because nobody was talking about it before. The issue around the Department of Health, I think, will be extremely useful, and what they're doing, because there is a federal approach to this. So I think we do need to hear. I think you're absolutely right. The Climate Council recommendations are important, but linking organizations, I think, is helpful. So linking RPCs with DOH, with hospitals, because currently in statute, RPCs don't link up with the health piece. And the mitigation plans now are moving forward with health because we're in a pandemic. But I think you're right. We probably need to go through and to analyze the language and to make sure that it's contemporary and that we improve it. So that's all.
I guess it just we have so many other bills on our plate right now, and this seems like this needs a deeper dive to make sure it's in coordination with.
Yeah, I don't know. We'll see. I don't think it will take that much, honestly. And remember, one of the goals that we have this year is to ensure that we're addressing climate change issues. No one is addressing tick-borne illnesses. No one. And so we want to make sure that the list of problems that are in the bill are things that we have in statute and that can be addressed, because we know those are real. We can bring folks in from, since I started this, other research has started at UVM with one specific person we could bring in and talking about climate change and health. So we'll see how that goes.
I just want to make sure it's coordinated with everything else that's going on and not sort of
Well,
hidden.
it's coordinated.
Well, it's not right now. So I want to make sure that if we're going to.
Oh,
do
I
that
don't know
on
what you're
bill
talking
and
about. I don't know how we can say it's, I don't know how we can see a finished product before we start, but we will do our due diligence. Other questions, committee? And it does link in with S90, Senator Terenzini, you're right. Other questions, comments? What we'll try to do is we'll try to fit this one in as we're looking at other bills and update it to the extent it needs updating. And maybe I'm wondering if all we have to do is say to add in some consideration of the Climate Council recommendations. This is really a planning document. It's putting people together and asking them to work together. That's all it is. And the DOH was very receptive to this. All right, I'm not hearing anything else. Okay. All right, so committee, Katie, we'll follow up with this one. We will get some folks in to testify, and if it looks like it's too much of a heavy lift, we won't do it. But right now, I think it's really important to continue work and recognizing that climate change and healthcare are linked together. This isn't something that happens in other committees. All right, update on S91 that we'll be looking at tomorrow. Is there anyone else you would like to hear from on S91, the parent-child centers? I actually have a recommendation that when we go through the bill tomorrow, that we ask some pretty we ask questions and of accountability, because the parent-child centers will be looked at as independent, and who's keeping track of data for a return on investment for parent-child centers. Does the accountability belong at CDD? Should it be more generally AHS? So I have a lot of questions to ask, and I'm thinking it might be useful to bring in some other folks from AHS, but I'll hold off on doing that until we've gone through the bill one more time and asked questions about it. Senator Hardy.
Yeah, I believe that that the parent-child center network representatives have met this week with AHS, and so they and AHS may have some things to report from those meetings. So maybe having director or assistant deputy direct, whatever, Miranda Gray.
We'll do that. Yeah, that's
would be
exactly, I'm
helpful,
thinking of
and-
that. Yeah. And also of Morgan Crossman, who is Bright Futures and has done some work in overseeing Head Start. So yeah, so let's go through the bill and then we'll make those recommendations and keep track of who you'd like. And
Well,
we'll
I mean, I
bring
think
them
we
in.
can do it all tomorrow. I don't think we need to.
Well,
prolong it.
I
And, I have
already,
an amendment of some language that we talked about last week.
Okay.
Some updates. So.
okay. I did ask, Aaron and I talked about this morning. didn't talk about it. We communicated about it, about the time that we have tomorrow, because we're going through some other pretty significant bills. So I thought I'd like to go through S91 tomorrow, and then if we need additional testimony, we're going to get that another day. We're not going to, we don't want to rush through it and then not be able to do the mental health work that we want to do. So, yeah, but if you have language that you'd like to share with us, we'll look at that maybe as we go through the bill, but we'll all be making suggestions for improvements with Katie. All right, anything else? All right, and I do urge you to consider the importance of that little S19. It isn't trivial, and it opens up some doors that now are beginning to open because we introduced the bill a few years ago. But I think we need to put something in statute that links climate change and healthcare, climate change mitigation, hazard mitigation response, and healthcare. So otherwise, it's going to drop to the bottom of the list again.
Madam Chair, I don't think anyone was saying it was not important. I'm just saying that the work is being done in other places and we want to make sure it's coordinated because we have this entire climate council that is
Got
working
it.
on it to make sure
I get
that
it.
it's coordinated.
I got it. We'll coordinate it. We're good at erasing silos. Maybe too good. All right. Anything else? Cheryl, are you set for tomorrow with your bills there?
Yeah, I think so.
Okay.
The peer respite and the peer certification.
And I'm going to link in the 197. Maybe we can put them all together. I'm hoping somehow, or unless they get in danger because of appropriations, we'll see. We can talk about that. Good. So as you're looking at those bills for tomorrow, again, similar to S91, any suggestions that you would make for folks you'd like to have come in and testify, and specific questions they'd like to ask? Okay. This is not good. We have 13 minutes. Is there anything else? Okay. You've got a 10-minute break Ruth is going to go out skiing. Aaron will go off the YouTube